Hello everyone, a very good evening to one and all. Today we'll discuss on a very short topic, that is stroke management guidelines. Many members have asked in comment section and also in our telegram group regarding the stroke management guidelines. It is very important for your practical purpose and also for your viva session and also for your exam, university exam, theory exam. So in stroke management guidelines, there is an acute phase treatment and also a long-term treatment phase is present. In acute treatment phase, you have supportive care. Second one is your antiplatelet treatment. Third one will be your anticoagulant therapy. And fourth one will be your recanalization therapy. Right? So we'll see each of these topics separately here. First one is your supportive care. In supportive care, it is mainly you have to stabilize your ABC, that is your airway, breathing and circulation. So stabilize airway, breathing and circulation. Second point is you have to maintain the temperature and oxygenation should be maintained. Third point is you should not leave the patient to hyper or hypoglycemia, that is you have to avoid hyper and hypoglycemia. Next, supposing if patients have the features of raised ICP, so when the patient have a features of raised ICP, you have to manage, you have to take measures to reduce the cerebral edema, that is by giving 3% saline or your mannitol you have to give, and you have to keep the patient in a 45-degree position. You should not kink your IJV. So all such measures you have to take to reduce the cerebral edema. So measures should be taken to reduce cerebral edema. Why you have to take measures to reduce cerebral edema? Because to ensure an adequate cerebral perfusion pressure. It is to ensure adequate cerebral perfusion pressure. Right? Yes. Next, this is regarding your supportive care. Next topic is your antiplatelet therapy. In antiplatelet therapy, you will start on the patient with tablet aspirin at the dose of 3 to 5 mg per kg per day. This aspirin should be started within 48 hours. Should be started within 48 hours after the ischemic stroke. Okay. So while starting aspirin, you have to rule out. What you have to rule out? You have to rule out. You have to rule out your hemorrhagic causes also. Okay. Unless anticoagulation and antithrombolytic therapy, you have to start on the patient with aspirin. So you have to rule out your hemorrhagic cause by taking your CT brain plane. Next, so you have to start on with aspirin at the dose of 3 to 5 mg per kg per day within 48 hours after the ischemic stroke. Next, after 14 days, you will reduce the dose to 1 mg per kg to a maximum of, you can give up till 75 mg. Right? Yes. So while giving aspirin treatment, you should ensure that the patient have been vaccinated for varicella and flu. Should be encouraged. Why? Because when you start on patient with aspirin, and if they get a co-infection with varicella or flu, they can end up in other syndrome called as Rice syndrome. Right? So you have to ensure that the patient is having vaccination regularly. Yes. Next is regarding your anticoagulant therapy. And anticoagulant therapy, you will be using heparin, or you can use low molecular weight heparin. So what are the indications for using heparin and low molecular weight heparin? Indications are when the child is having features of arterial dissection or cardioembolic stroke. third, when the child is having a hypercoagulable state, you will be using this hypercoagulable state. You will be using heparin or low molecular weight heparin. The dosage of your low molecular weight heparin will be 1 mg. This one 1 mg per kg per dose. 12th hourly you will be using subcutaneously. This is the dose of your low molecular weight heparin. This is regarding your anticoagulant therapy. Next is your recanalization therapy. In recanalization therapy, you have two. One is acute thrombolytic therapy, another one is mechanical thrombectomy. In acute thrombolytic therapy, here we use TPA. So what is TPA? It is tissue plasminogen activator. So we use tissue plasminogen activator for your acute ischemic stroke, and it is considered to be used between the age group of 2 to 8 years. This is mainly case to case basis, okay, and this treatment should be administered within 48 hours, within 4 hours and 4.5 hours of arrival. So this is to be administered within 4.5 hours of arrival of the patient to the hospital or with a symptom. Intracranial hemorrhage should be excluded. So while starting this treatment, your intracranial hemorrhage has to be excluded. Fine. This is regarding your tissue plasminogen activator. Next is your mechanical thrombectomy. Mechanical thrombectomy is mainly considered for acute ischemic stroke due to large vessel occlusion. So large vessel occlusion meaning when it involves ICS terminus or when it involves proximal MC or basilar artery. So mechanical thrombectomy can be used when it involves large vessels like ICS, proximal MCA and bacillary artery. And age group for this mechanical thrombectomy can be between 1 to 18 years. So this recanalization therapy, it is a controversial one in pediatric age group. So it is mainly based upon your centers and also based upon your case to case basis. So it is controversial in pediatric stroke, right? Yes. Next, regarding our long-term management. So in long-term management, you have two. One is neurorehabilitation, another one is seizure control in patients with epilepsy. Fine. So neurorehabilitation, you will be giving physiotherapy because in a patient with a stroke, they will have a maximum spasticity. So you have to start on with physiotherapy to the patient as much early as possible, and you have to start on with anti-spasticity drugs. Anti-spasticity drugs should be started, right? Next, this epilepsy can occur in 30% of children following stroke. So this can occur in epilepsy can occur in 30% of children with stroke. So you have to manage your you have to give the this anti-seizure drug when the child is having the symptoms of epilepsy, right? Next is your secondary prevention. In secondary prevention, we have antiplatelet therapy. Antiplatelet therapy is you will be using your aspirin tablet at the dose of 1 mg per kg per day for a period of 2 years. This should be used for a period of 2 years. Why it is 2 years? Because it is a highest risk for recurrence of stroke. So that you will be using for a period of 2 years. So highest period of recurrent stroke. So you will be using your aspirin treatment at the dose of 1 mg per kg per day for up to 2 years. So this aspirin dose can vary between 1 to 3 mg per kg per day also. Fine. Right. Next is your anticoagulant therapy. In anticoagulant therapy, you will be using a drug called your warfarin. While using warfarin, you have to maintain your INR between 2 to 3. First point. Second, indication for using warfarin will be when the child is having the features of cardioembolic stroke. When you found the cause of the stroke is a cardioembolic stroke, which is due to when the child is having congenital heart disease or acquired heart disease, or when the child is having hypercoagulable state, or the child is having a arterial dissection. These are the conditions where you use a warfarin treatment as your secondary prevention method. Next, for specific treatment for underlying causes includes in a child, this SCD is nothing but your sickle cell disease. In a sickle cell disease, the child should undergo a regular periodic blood transfusion. This is done to maintain 2 minutes, brother. This is done to maintain your HbS level below 30%. So the child should undergo periodic blood transfusion to maintain your HbS level of less than 30%. Yes. Next is, if the child is having congenital heart disease, then you have to go for surgical repair as soon as possible. Third, when the child is found to have a primary CNS vasculitis, you have to start the child on with steroids and immunotherapy. Okay, so these are the specific treatment for your underlying cause. Okay, this is regarding the treatment management guidelines for stroke. This is a very simple treatment management guidelines. We can tell it in your Viva session questions, and also for your this university exam 5-mark question also, detailed, short notes also you can write. Thank you so much for patience listening. Let's all learn pediatric together. Next video I'll upload Ayushman Bharat, and also you have asked for approach to global developmental delay, so I'll try to upload these 2 videos. Thank you so much.